Hi, this is Dr. T from Texas Integrative Medicine, and I just wanted to record a brief video to talk to you about mold toxins. You know, with the recent hurricanes and floods that we've had, especially in the Houston area of the Texas eastern part of the state, we've been seeing a lot more people that are coming down with problems related to mold toxins or mycotoxins. And I'm often asked by people to help them understand how can they find out if they are affected by these mold toxins. Well, first of all, the symptoms of mold toxins just quickly are overlapping symptoms of other environmental illness, but often include respiratory symptoms such as shortness of breath, cough, increased phlegm in the throat, tickle sensation in the throat. And we see a lot of symptoms of gastroesophageal reflux or acid reflux. We do see a lot of GI symptoms of diarrhea, bloating, constipation, nausea. In addition, we see lots of brain symptoms such as loss of focus and attention, anxiety, insomnia, sometimes depression. We also see people complaining of symptoms of mitochondrial dysfunction, which frequently includes severe fatigue and a lot of exercise intolerance or a feeling of crashing after any significant exercise. But mold toxin illness, of course, is mostly caused by either water-damaged building scenario causing indoor molds to grow, and sometimes it can be associated with eating food such as grains that have been secondarily contaminated with molds that give off these very potent mold toxins. The situation with a water damaged building, first of all, if you've had a water damage scenario, the water doesn't have to stay. As long as the home or the building was wet for over about 48 hours, there's always a risk that some of these mycotoxin producing molds can become established. Sometimes you can tell because there's a musty smell, or you can actually see signs of mold growth, but not in every case. Sometimes there can be mold spores in the air, and they're not really readily identifiable. Of course, the mold toxins come in primarily in that situation through being inhaled and then absorbed into the body. There are a number of different ways that the mold can be diagnosed. I feel that probably the most accurate and most direct would be to take a urine sample and then measure it in parts per billion of these various mycotoxins. There's a couple of labs that have these panels available, Great Plains Labs and Real-Time Labs. The test is often a little bit more accurate if you take some glutathione prior to the test in order to try to mobilize out some of the mold toxins into the urine. When the test is negative, when there's no significant mycotoxins identified in the patient's urine sample, it's usually because there's no significant mycotoxins in the body, but every now and then we can see this kind of scenario even when there are mycotoxins in the body, just simply because the patient's totally unable to clear the toxins through the kidney into the urine. This can oftentimes be related to very, very poor functioning detox pathways and often deficiency of glutathione. There is a number of other markers that can be checked to find out about mold in the body, including some markers of inflammation that are associated with the so-called chronic inflammatory response syndrome, or CIRS, popularized by Dr. Richie Shoemaker and some of his colleagues. These would be tests such as MMP9, complement 4A split product, TGF beta 1, tumor necrosis factor alpha, and some other markers that sometimes are abnormal when there are mold toxins in the body, primarily due to the effects of the hypothalamus and pituitary gland. We can sometimes see low levels of vascular endothelial growth factor, or so-called VEGF, and vasoactive intestinal peptide, VIP, in addition to abnormalities of ADH, antidiuretic hormone, and others. The problem with some of these so-called CIRS markers is that they're not necessarily specific for mycotoxins, and they can be abnormal as in association with other different environmental illnesses, including other stealth infections, for example, Borrelia burgdorferi infection, the so-called Lyme disease, or co-infections, viral infections, mycoplasma, chlamydia, some of these sorts of things. I'm asked often about the so-called HLA genetic typing, which I actually don't do a lot of. And the primary reason I'm not a big fan of it is it's a fairly expensive test, and sometimes it's not covered, or if patients don't have insurance, it's pretty pricey. And basically, I feel that it doesn't really lead to any actionable information. If we find out that a patient is in the so-called 25% of the population that would be expected to be more sensitive to mold, so you know that, but it's not going to really change your approach. And if you find that it's negative and the patient isn't in that 25% that would be more sensitive to mold, it oftentimes doesn't mean that you're just going to ignore the possibility that there could be mycotoxins contributing to the illness. So for that reason, I'm not a big fan of it. It's not particularly actionable. Also, if you do find that you're in that 25% that is mold sensitive, some people kind of tend to fall into a scenario of therefore being able to kind of put all their symptoms onto that, much in the same way that people that are found to have abnormalities of the methylation genes, such as the MTHFR genes, often become methylation cripples if they find that they have unfavorable genetics. It turns out that that's only one different contributing factor to chronic complex or environmental illness. So we sometimes do some of the inflammatory markers. Another thing that you can do to assess for mold is environmental evaluation. You can actually put out mold plates and then analyze those mold plates to see what sort of molds grow. You can do that in a little more specific way with a test called the ERMI test, or Hertzme test. ERMI stands for Environmental Relative Moldiness Index, and one of the companies that does that is Mycometrics. But just showing that there's mold in the environment is not as direct as showing that there's mold toxins in the body. In a future video, I'm going to go ahead and talk a little bit more about mold toxin illness and about some of the things that we can do to try to help the body clear when mold toxins have been identified. Hope this has been helpful. Please like my YouTube channel, and also feel free to check me out on texasintegrative.com. And if you're interested in a consultation appointment with me, you can call 512-800-5309 to see me in my Austin, Texas office. And we can also see people via telemedicine if they're Texas residents.
Medical disclaimer and legal stuff.